Y'all having fun with this so far? I noticed several of you that have been here quite a while today, so congratulations. I appreciate it. Again, my name is Joseph Brady, for those of you that are here for the first time, and I head up the research department at the Colorado Chinese Medicine University. And what we're going to be talking about today is one of the hot topics in acupuncture research, in that most cancer treatments, first of all, we're not going to talk about treating cancer, not directly. If Chinese medicine could cure cancer, there would be no cancer in China, but that's not true. However, we do have extremely good methods to keeping the patient strong and healthy throughout the treatments so that the oncologist can do their job. I have a few oncologists that I work with in my practice, and if we can keep the patient healthy and keep them from throwing up and keep them from being nauseous all the time and keep them strong, the oncologists love us. Together with me today is Chris Schultze, and Chris is with the School of Chinese Medicine as well. And Chris has a degree in chemistry from Rutgers Newark College of Arts and Sciences, and has worked as a chemist, subcontracting for the United States Environmental Protection Agency for 8 years. She owned a health food store for 15 years. Chris graduated from the Colorado Chinese Medicine University with her master's degree in traditional Chinese medicine in 2018, and is presently the registrar at the school. And so with that, right now, again, in the program that you got for the Expo, there's a literature review on the cancer treatments that we use in Chinese medicine. And there's actually some very good, solid evidence in terms of using acupuncture as an adjunctive therapy for treating people with cancer. Again, if we can work to keep the patient healthy and keep them from wasting away as a result of the Western treatments, then the Western treatments have a lot better chance of working and being successful. If the patient starts wasting away in the middle of the therapy, the oncologist has to stop what they're doing. And they hate that because it doesn't give them a fair chance to see if their therapy is going to work or not. And so Chinese medicine interventions target multiple cancer-related symptoms. The evidence strongly supports at this point. In that review that I did for the program, the citations are listed in the order of the strength of the evidence. And so the first ones listed have the strongest evidence. And this is one area in the scientific community that we have some of the strongest evidence, because it's such a need in the field of oncology to find a way to help keep the patient strong through the therapies. And strongest evidence is for relieving pain, nausea and vomiting, and fatigue, which we'll talk about, as well as a few others. So first is chemotherapy-induced nausea and vomiting. Acupuncture and acupressure reduce acute delayed chemotherapy-induced nausea and vomiting, modulates the vagal nerve and serotonin pathways, and national guidelines endorse the use of acupuncture as of 2022. And the evidence level, again, is the highest grade of evidence in Western medicine. Many times I'm talking to a Western medicine doctor and they say, well, there's not enough evidence, or the evidence is not that strong. And in some areas that's true. But when it comes to treating the symptoms associated with the treatment of cancer, we actually have some very high levels of evidence. And so when it comes, I'm going to have Chris talk about some of the more common kinds of treatments that an acupuncturist, herbal medicine doctor would use for treating nausea and vomiting. And so, Chris, if you got a patient coming in on chemo and they're puking their guts up, not to put too fine a point on it, what are some good points? What are some good treatments that can be used?
So first of all, the biggest point for reversing the chi that is going in the wrong direction would be large intestine 4 on the hand, and that is an excellent point for anybody who's having any type of nausea and vomiting at any point. There are also points on the wrist, which if you guys have seen, sometimes they sell these bracelets for people who have a propensity to nausea, like when they're on a ship or in
seasickness, yeah.
Yeah. Then the next point that I would consider anytime on a person who's having nausea and vomiting, which again is a sign of the qi going in the wrong direction, is stomach 36, Joe. I would definitely use that one.
And if people wanted to treat their own nausea, how can they find pericardium 6?
Pericardium 6?
Yeah.
Pericardium 6 is here.
I picked that one because it's particularly good for finger pressure and will help relieve nausea and vomiting. So basically, if you
In fact,
find
I have a little dot there.
crease in the wrist and come down about 3 inches and rub the heck out of it. If you're interested in spending money on it, Sharper Image Catalog has a little electronic device, and it's only $99.95, and has a little plunger in there that goes like this on that point. Or you could just use your finger and save the $99 and spend it on something else. But actually, it works well enough to where it's recommended for people that get seasickness all the time and get nausea, and works particularly well. I've done 5 acupuncture anesthesias now for surgery out of Lutheran Hospital, and found out 2 of the points that Chris pointed out. Large intestine 4, here between the index finger and the thumb, was the surgeon's favorite acupuncture point, because they know it releases endorphins strongly, and that relieves the pain. And so the surgeon can be confident the patient can get through the pain. Now, when I did them, quite frankly, the patient is under a sheet or a little sheet screen in front of her. And the patient did fine. I was scared to death. I figured if she yelled ouch from under that sheet one time, I was screwed.
So when you want to find it, you want to go right between, halfway between the 2 knuckles here. Halfway between, and then really dig in towards the bone. I mean, you can cause some pain there in yourself, but that pain is also going to be an indicator to you that you're actually accessing that point. It's going to be a dull ache.
Energetically, that point's about the size of a $50. And so when you find that little achy spot in there, yeah, you got it. Another one is for pain. And depending upon the type of cancer that the person has or the type of surgery that they have, the area of the pain can be all over the place. But yet still, acupuncture is known, and again, this is one of the areas we have a very strong, high quality randomized controlled trials that show that acupuncture is extremely effective for pain. In fact, I did a study where you compared the number needed to treat with opioids. And we actually do better than opioids do with relieving pain without any of the side effects and the addiction and all the problems that opioids cause. And that research was done actually at Walter Reed Medical Center, because the Army, particularly Navy, the Marine Corps, they're particularly interested in using acupuncture for pain, because since World War II, they've been using morphine for pain. And as a result of that, they have millions of veterans that are addicted to opioids at this point. And so they've been looking really hard to find alternatives. And acupuncture turns out to be a really good alternative. And so Chris had mentioned large intestine 4, but what other kinds of treatments would you use for pain? I'm trying to think. I had a particular patient, and this is an interesting case, but she had oral cancer.
Mm-hmm.
And after they cut everything out, she had this excruciating pain in her mouth that she could not, the drugs wouldn't even touch it. If you had a patient like that, Chris, what kind of approach would you take?
The first thing I would do is I would find, well, there's a ear acupuncture protocol called battlefield acupuncture. Obviously, battlefield acupuncture, this is used on soldiers who have a great deal of injuries, and it can cause pain relief in the whole entire body. But the second thing that I would look at is there are specific points, like for the jaw and for other face-related, in fact, whole body areas on the ear that work for anesthesia. So back when I was your student, Joe, back in 2016, I'd had a bunch of dental work done. And one of that, as part of that, I had some bone grafts so that implants could be easily put into my jaw. And this was severely painful. And I had grown up, in a time when doctors would say, here, take 4 ibuprofens at a time. But that went by the way. And when my dentist had worked on me, he gave me all these opioid prescriptions. And he said, you've got to take this because it'll take away the pain. Now, my experience with opioids is that it kind of masks it, but it's still there. And the rest of you feels like you're off on a cloud somewhere. And I hate that feeling. And I was in school. I needed to study. So I found that there was an ear anesthesia point for the jaw. And I dug around until I found it. And I could access it with either ear, and with the other, I could take my notes in class. And it would just stop the pain. So do you have your answer?
Yeah. Now, actually, that the points on the ear, when you look at an ear acupuncture chart, the Chinese didn't invent that. Actually, the French did.
Mm.
The Romans, during Roman times, they started using acupuncture anesthesia for battlefield surgery in Rome. I saw one science special on Nova that credited that fact for one of the reasons the Romans were able to conquer the world, is they had many more of their soldiers that could survive battlefield injuries. Well, the French kept doing that. They stuck to Roman law much longer than anybody else in Europe. And they kept doing that right up until the Napoleonic Wars. And by then, they knew more about acupuncture. But the French surgeons, if they were trying to cut somebody's leg off for gangrene or whatever, they didn't want the acupuncturist anywhere near the field of surgery. And so the French were actually the ones that came up with the idea of doing acupuncture anesthesia using ear needles and using the ear. So I thought that was fascinating. That's one of those areas, like Ken talked about the other day, where these things cross cultures at this point. And so there's a number of different things. Now, from there, we would look at, in addition to releasing your body's natural endorphins, when you release the endorphins naturally, your body also releases 100 other compounds that balance the effect of the endorphins. So you don't really get the addiction problems that you do with using it as a drug. The opioids only work because they're looking to mimic your body's own natural endorphins. Those are opioid-like substances that your body uses to kill pain. But when your body does it naturally, it releases 100 other things at the same time that help balance that effect. And so it behaves much differently than when you take the pure chemical and inject it into somebody. It's one of those areas that in our medicine, we don't think randomized controlled trials are the be-all and end-all of research, as randomized controlled trials are what gave us opioids in the first place. In carefully controlled clinical settings in a hospital, those drugs work great. But it never even dawned on the researchers what would happen when those drugs hit the street, and the problems with addiction and overdose deaths that we've had since. And so one area is that I think randomized controlled trials are not the be-all and end-all. Peripheral neuropathy is another area that acupuncture has got some moderate levels of evidence. In my clinic, it seems to work very well with chemo-induced neuropathy. But I'll say that with a little bit of a caveat, in that it kind of depends on the nature of the chemo, and it depends a little bit on the nature of the patient. Sometimes the chemicals that they use will damage the nerves so bad that they're not coming back. But most of the time, that's not true. And they just kind of deaden the nerve and desensitize it. And that'll manifest in one of two ways. Either it goes completely numb, or it leaves that uncomfortable pins and needles feeling that's left behind. And with strong stimulation, many times we can bring those sensations back. Initially, sometimes I got to warn patients, initially it might not be the most comfortable feeling when it first comes back, but that quickly settles down into a more normal kind of feeling. So Chris, and the most common one I get is either hands or feet with the neuropathy. If a patient's got the bad neuropathy in their feet, and say like the pins and needles or numb feeling, what kinds of points, what kind of treatments would be good for relieving that?
So before I go into that, Joe, I was just reading an article yesterday where it pointed out that people who have regular neuropathy due to diabetes, frequently it depends a great deal on how long they've had it, whether they respond or not. And that precisely chemotherapy-induced peripheral neuropathy is the most responsive type of neuropathy to acupuncture. And personally, I would consider probably E-stim, tapping into the large intestine meridian and the stomach meridian via stomach 36 or whatever the local point is that's most available. So on the arm, that's probably large intestine 10, which is known in Chinese, what is it as, arm 3 miles? And then leg
equivalent,
3
yes.
miles on stomach 36. They're called that because stimulating these points will give you extra energy that can make your endurance stronger. I remember going up on a hike up by Echo Lake with my brother, and you can see me, I am out of shape. And I was even more out of shape at the time because I was a student. And so here's my brother and all his family, they're hiking over the mountain, and here's me huffing and puffing like a mile behind them. My brother doubled back. He's like, "What are you doing, Chris?" And I'm like, "I'm stimulating the points. I'm stimulating the points." And I made it over, slowly, but I made it. But in the same way, you can access that extra energy via e-stim for your patient to the area wherever that is happening. And that's what I've done for patients too.
What the electrostim does is it provides a little bit of constant stimulation on the needle. And with the neuropathy, strong stimulation is really the way you bring it back. Stomach 36 that Chris was talking about, if you feel on the bottom of your knee and go down the bone a little bit, you'll feel a little bump in the bone. Find the bottom of that bump and come to the outside about an inch. And that's Susan Li, stomach 36, leg 3 miles. And according to Chinese legend, if you're so exhausted that your legs feel like lead and you cannot take but another step, if you rub that point, you can walk another 3 miles. Hence the name leg 3 miles.
And
It's
here
also-
I am to tell you it's true.
and very popular among longshoremen in Taiwan. In Taiwan, you don't really get to retire. And so it's not unusual to find 80 and 90-year-old longshoremen moving heavy boxes on the docks all day long. And where do they get the energy for that? Susan Li. They have these gentlemen's clubs, and for lunchtime on a break or after work, they get together and, well, they do moxa on stomach 36 to get their energy back, to the point where many of them will have a scar where that point is. They've done it so much, and they believe that's where they get the energy from. And then they also spend the time sipping whiskey and smoking cigarettes, which isn't necessarily a healthy activity, but these guys are in their 80s and 90s, so they earned it.
So Joe, regarding moxa, moxa is also very, very good for stimulation locally when there's neuropathy. Of course, as you all know, the person has a lack of feeling in that area. So it's really, really important to put your fingers there as a guard to make sure that the moxa doesn't overheat the point for the person.
So those of you not familiar with moxa, moxa is an herb, Artemisia vulgaris. Anyway, it has a unique ability that it has this very penetrating warmth that penetrates deep down inside the body. It's one of the only techniques aside from putting your own qi into the patient, it's one of the only ways you can actually add qi to the patient. Mostly the needles are moving qi around or manipulating the qi that you already have. Moxa is a technique that you can use to actually add energy to the patient. Immunosuppressant, and I didn't talk about last time, another one is Wang Qi-based herbal formulas support nerve recovery, and also with, where am I?
You were going to, no, the next
There
one
I am.
after that,
Immune.
immunosuppression.
Astragalus, and actually Wang Qi, astragalus, its effect on immune function were actually discovered back in the 80s
Mhm.
when we had AIDS patients. When my wife was at the Health Sciences Center at CU, they had a program for treating this back before they had the drug cocktails for dealing with the AIDS patients. And so at that point, since we didn't have any treatments for AIDS, they actually did quite a bit of research on Wang Qi or astragalus and found that it does indeed, like the Chinese have said for centuries, strongly boost your Wei Qi, or what we in the West would call immune function. And it improves white blood cell counts and cytokine regulation. And again, this is an area where more research is needed, and that the research is only moderate in its quality. And so we need better, stronger research on it. But in terms of using acupuncture, particularly for increasing immune function, what would be some good points? What would be a good strategy for increasing immune function?
Again, stomach 36 is way up there. Ren 6, the Sea of Qi, that's about an inch and a half below your belly button.
That's your center of gravity, your danjian in Chinese medicine and also in Tai Chi and Qigong.
These are points that, I started my career as an acupuncturist at the school when I was 54. Now, what you want to understand about that is that I had just come here after moving cross country and I was seriously depleted. And I quickly found which points would help me feel better. And those 2 points, the Ren 6 and also stomach 36 and later lung 10, those points were the biggest source of energy for me. Like when I was unable to, think or memorize or whatever. But also they would be the ones that you would use for your patient for energy. Now, I don't think maybe you haven't checked your roster yet for the class that you're having later on this trimester for the doctor program, but I'm enrolled in your class.
Oh, good.
And that's why I'm
I
currently.
get the flunker.
Yeah, I know, you will too. But that's also why I've been taking courses on oncology in the doctor program at CCMU. But go on. Immune suppression, Wang Qi is in almost all the formulas that are used for patients of oncology, of chemotherapy, whose doctors don't mind working with an acupuncturist or don't mind taking herbs. There is such a wealth of information out there now. You can find a lot of articles, good articles on PubMed.
And if the oncologist is not interested in their patient using acupuncture or herbs, which I don't really understand, but I'll respect them on that if that's their opinion. It means they haven't read much research lately, but if that's their opinion, okay, there are other ways. One of the easiest ways, and again, we'll be doing a session a little bit later on Tai Chi and Qigong, in that, one recent study just found that while you're exercising, in every cell in your body, you're creating a biochemical environment in which tumor cells cannot grow. And right now, that's a fascinating area in the research because they can figure out how that works. And they've known for a long time that exercise is a major risk factor for cancer. And they're beginning to think they might actually have an inkling as to why that would be. But in terms of somebody that already has cancer, they've known for a while now, for example, with breast cancer, that physical activity of any kind actually reduces the risk of a recurrence of the breast cancer down to 1/3 the risk. So that takes 2/3 the risk right off the top. If you can get somebody even after they've had cancer, after they've gone through their chemo, and just how start a physical activity program at that point. One of the reasons in China, for example, in the hospitals, they use a lot of Qigong and Tai Chi for this kind of exercise is because usually the chemotherapy and the treatments from the cancer or the cancer itself just knocks the hell out of the patient. And they don't have a whole lot of energy. And many times they've got pain. In which case, doing gentle exercise, that's mind-body exercise, that's meditative movement, can be an excellent way to begin someone who's never been physically active before, and to get them up on their feet and get them moving. And when you move, you also move qi and blood. And in Chinese medicine, where you have a free flow of qi and blood, the immune system works just fine. So physical activity, diet, these are all crucial parts of a cancer patient's therapy. And what they found in the literature, and also what I've found in my clinic, is patients that have been diagnosed with cancer. I myself, I was diagnosed with cancer in 1959. I was diagnosed with leukemia. The doctors told my parents I had less than 6 months to live. I've gone to the funerals of 2 of the doctors that told my parents that just out of spite, and I'm still here. But what I've found in my own clinic and what the literature confirms is that it takes the person that maybe they've never lived a healthy lifestyle before, but after a cancer diagnosis, maybe now they're motivated, because if they do the exercise, if they start eating right, eating fruits and veggies and getting some nutrition in them, many times they have a much better chance to prevent a recurrence of that cancer. And it does take this whole lifestyle approach to make that work. I wish there were a magic ingredient that would make people get over and kick the symptoms of cancer quicker, but there isn't. If you're fighting for your life with cancer, then you have to train like a martial artist would. You've got to take every advantage that you can. And you work on your diet, and you work on your exercise, and you work on your stress levels, and try to do all those boring things that the health authorities have been telling us to do for years, but none of us seem to ever have the time to do.
So Joe, a very recent article pointed out that light stretching is enough. And of course, Tai Chi and Qigong and yoga, these are all stretching type of exercises. So
I got a good one for you. They did some research at Harvard with pigs. And don't ask me how they got them to do this, but they did a study where they took pigs and taught them how to stretch. I don't know if they had like little pig yoga mats, or the photographs of the researchers stretching the pigs was hysterical. But they've known for a long time that stretching helps alleviate your aches and pains. But now they have a better understanding as to why. You know that little uncomfortable point you get to at the end of a stretch, where it just gets that little bit uncomfortable? That uncomfortable feeling actually activates a gene called NF-kappa B, nuclear factor kappa, light chain enhancer of activated B cells. It took me 4 days to learn how to say that, so I try to work it in a conversation whenever I can. But it's the master inflammatory gene in your body. And it also explained why many like arthritis medications actually use like things like pepper, which causes inflammation. And if it's hurting, wouldn't you want the inflammation to go away? Well, the reason that works is, you know, when you eat a pepper and your mouth starts burning, that's an inflammatory response. This gene gets activated. But how long does that last in your mouth? 10 minutes?
10 minutes, yeah.
Kind of depends on the pepper, right? I'm not talking about those ghost peppers, normal peppers. In which case, 10 minutes, it don't burn no more. When it deactivates that gene goes through and deactivates 15 other genes that are inflammatory genes. And so the idea is you kind of boost the inflammation a little bit with the herb or the chondroitin or pepper or whatever you're rubbing on. And then as it subsides, it starts to take all the other inflammation in the body with it. So I thought it was fascinating. They've known for a long time that stretching helps with your aches and pains. It's nice in a scientific sense that at this point they have a better understanding as to exactly why. I just really want to talk to those researchers about how you get a pig to stretch and do yoga. Couldn't they do Tai Chi and
That's
also?
kind of a very strong visual there.
We tried with Tom Johnson up at CU in Boulder to do a study with rats and Tai Chi,
Oh,
but trying to get them to get through a form was like pulling teeth. Another common symptom with cancer is gastrointestinal problems. In addition to the nausea and vomiting, people get diarrhea, they get anorexia, they can't eat, they start wasting away, and the doctors hate that. And we talked about Wong Qi, another one of the Wong herbs, Wong Qin, reduces the toxicity in the chemotherapy on the digestive system. In that what the doctors really want is they want the chemo to be toxic to the cancer, not to the patient. And when it comes to gastrointestinal symptoms, they found that herb combination, that particular formula, helps to protect the digestive system from the effects of the chemo and making it so that it's much more tolerable. And again, if you talk to any cancer doctors, they love that idea. If they can keep the patient eating and keep the patient healthy instead of losing weight and wasting away, they have a lot better shot to make their thing work. And again, this is another area where there's still more research that's needed, but there is quite a bit of moderate level evidence that acupuncture and Chinese herbs can really help with these other kinds of gastrointestinal symptoms as well as nausea and vomiting. Any thoughts?
No, in general, the use of Chinese medicine formulas at the same time that you're undergoing chemo, or your patient is undergoing chemo, I should say, it seems to activate specifically the areas that they want to address with the cancer rather than the whole body. You know, generally chemo is viewed as a kind of a shotgun approach. You're shooting all these bits of bullets into the body, and you're killing all these cells, and you're hoping that the majority of the cells of the cancer are what's going to get killed. Now, with Chinese medicine, you can make this kind of directional with Chinese herbs, with moxa, with cupping, with acupuncture, all these to a lesser extent, but mostly with the herbs. It can directly cause the chemo to affect only those tissues that need to be affected and protect the other tissues, which is something absolutely incredible that could be happening.
Along those lines, you kind of make me think here, Chris. Years ago, when Jackie and I were at the Health Sciences Center, we got to work with some of the cancer patients using Qigong. And I should have brought one. We still have one left that my kids didn't destroy, but it's a little device that has a type of alcohol in it that only boils when it's at a very low temperature. But for our body, it boils somewhere between 96 and 98 degrees. So we'd have the patient hold it and then imagine as vividly as they can their hand warming up and warming up. And their hand would actually warm up to the point where the alcohol would begin to boil, and really cool special effect. And the patients go, oh, wow. But it taught them that you can control the blood flow in your body. And then we would teach them that when they're sitting in the chemo and they've got this poison going through their body, to try to imagine that blood going to the tumor itself and carry more of the chemo to the tumor. And then once they learn how to move the blood back and forth in their own body, when they're not on the chemo, to teach them how to make the tumor cold and starve it of blood. In studies at UCLA that found that made a 3% difference in survival rates, that little bit of Qigong. Now, 3% doesn't sound like a lot, but if you have a form of cancer with a 1% survival rate, and you increase that, that's actually quite significant. Cancer-related fatigue. Acupuncture, moxibustion, we talked a little bit about. Qigong, improved fatigue and vitality. Systematic reviews of multiple randomized controlled trials show significant improvements versus control. And again, it's another one of those areas where our medicine needs stronger evidence. And so we talked a little bit about stomach 36 for dealing with fatigue. What are some other things we can do for fatigue?
Well, definitely moxa. Moxa really, really helps. And there are different points in the body at which you can use it. Kidney 3, for example, which is right behind the ankle. towards the outside, towards the Achilles tendon. I mean, I could put my foot up here and show you, but the thing is that putting moxa on that point or burning moxa near that point is going to give you a jolt almost as strong as caffeine. And so that would definitely be a point that I would consider using. Stomach 36, moxa again. I had a patient who had been going for chemo for a while, and not only because of the fatigue, but the first day you don't feel so bad because you've still got all those hormones inside you that increase your energy. But by the third day, you're like, you don't want to get up from bed. And doing moxa and for this person on those points, stomach 36, Ren 6, kidney 3, not only did it raise their energy level, but it also raised their white blood cell count. As you know, this is really important for anybody who's going into chemo long-term. They check your white blood cell count before they can give you more chemo, because if your blood cell count is low, they're not going to give you the chemo until you have the energy to produce more of that. But now I've gone off your subject of cancer-related.
No, not at all. And fascinating for me is when Jackie and I, Shanghai brought us to China to see Kunshan Hospital. Again, we talked about it's the world's first hospital where Chinese medicine and Western medicine are practiced on an equal footing, and the doctors are trained in both. And so it was fascinating watching the people going in for their chemo infusions. They had them lined up in the hallway outside where they would get their infusion, and they're doing ear needles on them to calm their anxiety and get them to relax a little bit. Maybe give them something a little therapeutic to do rather than sitting there in the waiting room dreading getting their chemo. And we've got another doctor we're working with at the University of Oklahoma. He's working on a project, again, from Chinese medicine. He was inspired. He's Chinese, but didn't know much about his own culture, was fascinated with what they're doing in China. So he's designing a thing while people sit there in the clinic getting their chemo. He's going to have them practice calligraphy, Chinese calligraphy and art, so that they have something productive to do to keep their mind off of the stress of what they're going through, and have it add, hopefully, a little bit of an extra therapeutic benefit, if nothing else, simply to distract the patient from the stress of everything they're going through.
I just wanted to add, I forgot to say that with the moxa on stomach 36, they would call me in to do this moxa for this patient so that their white blood cell count would go up before chemo. And it did. Even if they had been told, oh no, it's low, we're going to check again the day of, but it's low right now. And with the moxa on stomach 36, it'd go right back up.
And as we get the doctors seeing more and more of these ways that we can help augment and supplement what they're doing, they're getting more and more excited about using Chinese medicine, because we handle a lot of, quite frankly, a lot of the knucklehead stuff that the doctors don't want to deal with. The oncologist wants to cure cancer. He doesn't want to deal with somebody throwing up. The oncologist wants to cure the cancer. He doesn't want to deal with their nausea. And so it works very well when you put the two together. Lymphedema is another one that's quite common and post-treatment. And acupuncture and Qigong improve circulation and mobility. I had a woman with lymphedema so bad in one leg, the doctors told her she'd never get rid of it. And it was an ongoing problem for her, I'll admit that. But with acupuncture points, particularly, it would use spleen 9, which drains damp, and it would actually drain a lot of that lymph fluid out enough to where she could function. Now, in a couple of weeks, the legs would swell up again and she'd have to come in and get treated again because of what they had cut and what they had done with the treatments that she had received. But it actually worked quite well. Any ideas on treating edema?
Spleen 9, spleen 6.
These are specific points that they're energetic, is that they drain damp. And
you can think of damp kind of as inflammation with a buildup of excess fluids. Again, to what you heard yesterday and to what you heard today with regards to moving qi. So when there's stiffness, when there's pain, you want to be able to get the flow of qi, which if you want to think of it as electrical energy going along fascia, that's great. Or if you want to think of it as electrical energy going through the muscles themselves, as Dr. Kasharat mentioned, that's great too. But if there's a blockage, if that energy doesn't easily move through those tissues, you're going to have pain, you're going to have stiffness. And anything, whether it's stretching, acupuncture, moxa, warming, anything that you do for that is going to be helpful.
Another area is anxiety, depression, and insomnia. And these are actually, this is only a little bit of evidence in terms of Chinese medicine in these things. But if any of y'all students and practitioners out there would like to apply for a grant, NIH is desperate for research on ways of treating these things. We don't really have good anxiety or depression drugs or treatments. And the way in Chinese medicine works and the effect on insomnia, we can do things without drugs that perhaps don't really need drugs in order to be treated. And the drugs that we have don't really work all that well. Yet we do quite well with anxiety and depression and mood disorders and insomnia and sleep problems.
Yes, absolutely. First of all, the point that's traditionally used for sleep disorders is Anmian. It's right here behind the ear on the curve of the skull right there. Easy to find. But that point helps people be able to relax enough to sleep. Depression and insomnia and anxiety, I've used a lot of ear points for that. I'm sure there's others throughout the body. If you think that I'm weighing too heavily on ear acupuncture, I've done that because it's effective.
The point on the neck that Chris is talking about is its name is Anmian. And it's actually where the pharmaceutical companies stole the name Ambien.
Are you sure?
They changed one letter.
Wow.
It's the Chinese word for peaceful sleep. Now, the point doesn't work anything like the drug. They just stole the name. I always thought that was fascinating.
Thank you. I didn't know.
Right now, they did publish a couple of years ago, they published the entire Chinese Bensao, all 6,000 herbs in English. And it's $2,000 for the book if you're interested in a little light reading to help you get to sleep at night. But actually, they're selling them like hotcakes. Who's buying them? Pharmaceutical companies. If you're a young pharmaceutical major in college or in graduate school, postdoc, easiest way to make your name and make a career for yourself is to take something from Chinese medicine that over the last couple thousand years they've shown to be effective. Find the active ingredient for that, and you make your name in pharmacology. That's a whole lot easier than spending 30 years of your life trying to develop a synthetic drug all on your own from scratch. And so recurrence prevention and quality of life are what Chinese medicine and oncology kind of summarize to. We can help improve survival and reduce recurrence, support immune regulation and stress resistance. We can help with pain, nausea, vomiting, a lot of the symptoms that make people so miserable as they're going through treatment for cancer. And many of the treatments they have these days work and work quite well. The trick is, can you keep the patient healthy and strong throughout the process without them being wasted away?
So I want to share with you a visual. The professor who's teaching my oncology class, Dr. Tim Ross from Bastyr University, he was telling us that because he's been working at this for quite a while, he does have patients whose doctors don't mind giving the patients herbs. And he does have patients who, their doctors or they themselves would prefer not to take herbs. And he says you can tell the difference between those who are and those who are not taking the herbs with their chemo. You can tell it by their vitality. You can tell it by their skin. You can tell it by their hair and by the way they move. And most of all, you can tell it by the fact that those who are taking the Chinese medical herbs as well as the chemo, they, gosh, I lost the word. Their vitality is better, but they don't age as fast. Their aging is much, much less.
Wait a minute, say that again.
Right. Their aging is less. You can tell the difference by looking at the patient.
I will let you know that Bai Hui on the top of the head, and one of its energetics is supposed to return gray hair back to its original color. And I must admit, so far, I've had no luck.
Me, on the other hand, I use that all the time, but not for that.
So in the program for the Expo is a set of literature reviews. And the literature review for everything we talked about today are in there if anybody is interested in following up and getting more information from the actual studies themselves. And again, they're ordered in there in terms of the strength of the evidence. So the ones on top are the strongest level of evidence, and then on the way down. And again, in acupuncture and Chinese medicine, the evidence varies quite a bit. But it's exciting right now because every good study they do, they're finding that acupuncture works just like the Chinese said it would, in which case for Western doctors, that's an exciting time. So we're going to go ahead and take a 10-minute break, and the next talk we'll do will be one on acupuncture and headaches.
Thank you, Joe.
Thank you, Buck.